Hi, my name is Shannon DeMoss, and I'm the audiologist that serves ESAC schools. I work for the AEA, and I work with the deaf and hard of hearing students. I test hearing and I also help them with their equipment and training parents and teachers how to use the equipment, along with accommodations in the classroom that make our deaf and hard of hearing students more successful. So the first one I'm going to talk about is Maddie, and Maddie has a severe hearing loss in her right ear and a moderate to severe hearing loss in her left ear. She wears a hearing aid in her left ear only. She does not wear one in her right. The right one is too severe to really get much benefit from hearing aid amplification. So she is particularly challenged in that way, that all the information is coming into one side. That can cause some difficulties with localizing where the sound is coming from, cause problems if it's someone's communicating during a noisy or transition time. Can be especially difficult when you're listening with one ear only. Her hearing aid does improve her hearing, although it does not restore normal hearing. So it will improve it. She will hear more sounds, but she's going to still have some difficulty with those high pitch consonant sounds that are often unvoiced and very quiet, even for those of us that have normal or near normal hearing. So she'll have more problems hearing the S, TH, CH, C, K, those kind of sounds, and she'll hear the low pitch consonants and the vowel sounds better. So A, E, I, O, U, the M, the D, the B, they're all voiced. They're a little bit louder, and her hearing is a little bit better in that area. As we move to the high pitches, that's where her hearing is poorer, and those sounds are soft sounds anyways. So it really affects the understanding. With hearing aids on, she will probably hear that you're talking a lot of the time, but she may easily misunderstand what's being said. For example, if I were to say to her, not looking at her, saying cat, hat, sat, fat, she would be hearing ot, 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 ot. So therefore, she's using her vision, she's using contextual cues, she's trying to look at the rest of the sentence and kind of see what would fit in, what would be appropriate word there. So she's using her eyes, she's using her hearing, her residual hearing, and really picking up and putting that sentence together. And that's a lot of work for a student to do, because at the same time they're working on what you just said, you're also giving them more information simultaneously. So kids work really hard listening at school all day, and they will become fatigued at the end of the day. I often compare it to like listening to someone with a strong foreign accent give a lecture, and you're trying to listen and learn, and you're really struggling to understand, and you feel like you're leaning in, trying to concentrate on what they're saying. And so, kids with hearing loss really have to focus more, be very motivated to listen and learn, and they are exhausted usually by the end of the day, especially at the beginning of the school year. So keep that in mind. I have a few things I'm going to go over for in the classroom. Maddie is a sweetheart. She's a great, great girl. She's very independent with her hearing aids and her FM system, so she's going to be a huge help to you guys. Her seating in the classroom is very important. She will need to be seated where she can see you well. She can see your facial expression, read your lips, look at any visual aids that you have to help supplement your lesson. So I hate to put her right in the center, front row, because no kid likes that. But I would say with her left ear toward the area of instruction. So if you tend to instruct in a certain area, if you can have her towards the front with that left ear toward you, that's going to be best for her. I know a lot of teachers roam up and down the aisles, and I don't want to change your teaching style at all, but I just want you to realize when she isn't seeing you, it's more challenging for her to hear you and understand what you're saying. She'll hear you, that you're saying something again, but she may misunderstand. And so just if you can still wonder to check on things, but maybe keep that in mind when you're giving important instruction, that when she sees your face, it's going to be a lot more clear to her. Also, it's important, like I said, to get her visual attention whenever possible when speaking to her. She reads those lips again, and so if you're going to talk to her, getting that visual attention first is very helpful. You guys often already do that with your class. You say, class, eyes up here, things like that make your class room stop, look up at you, and then you say the important message. So that's wonderful. That helps all the kids, but it especially helps someone with a hearing loss like Maddie's. So, and sometimes if it's something you specifically want to say to her, say her name first, wait for her to look at you, something like that. And she's much more likely to understand what's being said. If the room is quiet and you have the mic on, she may be able to figure it out even without looking at you, but it's easier for her if she is seeing your face. I know this isn't always possible, but just keep that in mind and do your best. Often too, you'll want to check her understanding, her comprehension. And the tempting thing to do is to say, did you hear me? And I even find myself doing that quite a bit, to students. And kids with hearing loss always nod yes. Yep, they've heard you. And that doesn't mean that they've necessarily understood the message correctly. They may think they have heard it all, but they don't know what they're not hearing. So when you're checking their comprehension, instead of saying a yes/no question, try asking them an open-ended question. Something like, tell me what we're working on, or what are we supposed to do with these numbers, or where they have to give you that information back. That's a much better judge of what they've actually understood. So keep that in mind. When you're wearing the microphone, which is the part of the FM system that you'll be wearing, and Maddie's preferentially seated kind of toward the front, and you're having a class discussion, there may be times when kids behind Maddie answer questions. If you can try to remember to repeat their answers, that is very, very beneficial for Maddie, as opposed to a teacher saying, oh, Joey, that was a great idea, good answer, and she has no idea what the idea or answer was. So if you can kind of get in the habit, again, of repeating their answers during class discussion, it helps them all, but especially Maddie in that situation. Kids with hearing loss all have some issues with vocabulary. They just haven't heard all the words and all the meanings. Since they've missed out on hearing early on and had, improved hearing with amplification, but still missing out on big chunks and fragments of speech, they aren't going to know the meaning of all the same words that you would expect someone in her 8th grade to know. She may surprise you and have beautiful vocabulary at times, but then there may be a situation where it seems simple, but she's not sure what you're saying. I use an example that I worked with a middle school student last year who has always lived in Iowa but did not know what a snowplow was. And we were all kind of in awe because we're like, they're out on the streets every day, on the winter almost, it seems. And he'd seen them before, but he didn't understand that they were called a snowplow. There's many, many examples to give. So it's just simple little things like that sometimes that they're not sure. So try saying it again, or saying it in a different way, or adding a visual, something like that will really help them. But keep that in mind that you might have to restate it, or just realize it's just that she just hadn't heard it in that context probably before. Sometimes kids with hearing loss, especially like Maddie's, they really miss out on that incidental learning, which is so important. And they say like up to 70% of what we learn is incidentally, or by overhearing a conversation between a teacher and a student or two other people. So don't assume if you've told a student some information and you're expecting the kids to overhear it and understand it so you don't have to repeat it again. For her, you may have to repeat it again and tell her directly. She just isn't able to hear it clearly by listening to a different conversation when the person isn't even looking at them. So just realize that a lot more things have to be directly taught to her. She's a bright girl. She should pick it up well. Anytime you can write page numbers, important words, anything about the lesson on like your whiteboard or something is very beneficial too. She may hear the word but then not recognize the word, and then she sees the spelling. That's going to reinforce for her. It makes her listening easier. And also, if anytime you can give her, maybe if it's going to be tough vocabulary in a lesson coming up, let her know ahead of time, or let her take some vocabulary with the definitions so that she can glance it over and become somewhat familiar with it. That would be very helpful for her too. I know I keep telling you she needs to see your face, and it's difficult with these masks on lately. I don't want anyone to spread germs or get sick, but also the kids that really need your facial expressions and need to look at your mouth when you're talking, it becomes very, very challenging. Even if they're familiar with the talker, it's surprising how much they miss once that mask is put on. An example, one parent told me that she has 2 daughters that have significant hearing loss, and they went to their doctor that they've always gone to since they've been babies, and they're very familiar with him and talk with him every appointment. Well, he had a mask on, and he was trying to ask them a question, and they just stared at him blank, and they just looked over to the mom for clarification because they just were not sure what he was saying. So keep that in mind. I'm not sure if the teachers are wearing masks there or not. If you are required to wear masks, you might want to consider something like a clear mask or a shield. If you're wearing, sometimes at places they have you to wear a mask and a shield, but anything that's transparent around the mouth area is really helpful. You just pull this over your head and put it on, and it goes right across, your nose and your mouth. So they can easily read your lips this way. It will make them feel much more confident and successful. They won't be stressed about not being able to read your lips, and you won't have to repeat as many times. If this is something that you're interested in, certainly talk to your principal, and I can let them know where AEA got us some of these, and I'll let you guys know where to purchase them at. But they are helpful. There are other versions of it, and again, a shield is good too, but if you have to wear the mask under the shield, you're running into the same problem. When they are reading your lips, try not to over-exaggerate what you're saying, or, they won't think that's normal. They'll probably think that you're angry or there's something wrong with you. So just talk normally, when you're facing them. Include them in the fun and the lesson and the jokes, because they want to be a part of it too. She is really a special girl. I completely enjoy her. But I encourage you, if there's a problem going on with her FM system, her hearing aid, or she's not responding as well as she normally does, please call me, text me, email me, and let me know. I want to stay on top of that. A lot of times there's something I can drive to the school and take care of it right away. I work in several districts, but I'll get there as soon as I can. Or sometimes I can just tell you something over the phone or text you something back that is a simple fix too. So I'm going to be sending you my number. I'm going to be sending you a sheet that looks like this that has a lot of the information I went over, and it will have my cell phone number here and my email. And please feel free to use my cell phone number. That's the easiest way to get a hold of me. Like I said, I'm in and out of schools all day. So text me or call. And if you need the email, I check that frequently too, but the phone is usually right by me. And that's 515-408-3580. Again, that's 515-408-3580. And so you'll be getting that. I'll also be sending you a little form about cleaning the FM system. Whether you have Maddie give it a wipe down between teachers, or if the teachers choose to do that, that's something you guys can certainly decide. She's old enough that she could do it. The last school I was at, they just talked about they had a spray bottle with disinfectant and a cloth there that maybe she could just do a quick quick mist on the cloth. We don't want the cloth wet